Hey everybody, welcome back to Built for Medicine. I'm Dr. Corbin.
I'm Dr. Medrano.
And today we're going to talk about our top reasons to pick medicine.
Now these are our reasons, things that we've thought about as we're sort of reflecting through our journey currently right now in residency training. So this is just our opinion, but we're going to give you a few things that I think will be really good to think about as for those who are applying to med school or maybe even just starting out in med school.
First reason to pick being a physician is if you really value the patient-physician relationship.
This is what I think is one of the most fulfilling things about being in healthcare, about being a physician, just being in that situation, sitting down one-on-one with a patient who's going to tell you, of course, all their issues, right? Their health complaints, but also things that are going on in their life, things with family, things with work, and so on. So I really think this is what a lot of us really think about when we think about going into medicine, is being in that position. And it's really fulfilling being able to kind of sit down with someone and just being able to just listen. I think a lot of patients just want to be heard. And then ultimately coming up with a plan for their health to really get them in the right direction.
Right, and this also comes in many different forms, right? So for us from radiology, we may not see patients face-to-face on particular days of radiology, and sometimes we do see them every single day. And when you're not sitting face-to-face, you're seeing them from the inside out, which is one of the most intimate positions you can be in, because oftentimes we're the first to see what the actual problem is or make the diagnosis that helps treat the patient. And so this is a very important position to be in, and if you value that, maybe being a physician is for you.
The next thing, clinical opportunities. So all the stuff you see on TV, it's literally just like a little snippet of what medicine is. It's so vast. There's so many different specialties, and then there's subspecialties on top of that. It's overwhelming. I can even mention all the different types of specialty options that there are if you're going through the physician track. But there's so many opportunities to just see things you've never seen before, learn areas about things about the body that you've never even realized people are doing research in. So, we picked radiology, and radiology actually covers the entire body. So we work a lot with other clinicians, and we're talking about GI pathology one day, neuroradiology another day, and issues with the heart, chest, and so on. So it's cool to, as a med student, be able to have the opportunity to pick your electives, pick rotations that you are interested in, and just see how many different clinical scenarios there are, different problems there are to solve in medicine.
And when we think about clinical opportunities, it's everything from pathology, understanding like on a microscopic detail of what's going on in the patient, all the way out to surgery, where you're physically interacting with the patient, or digitally, like us in radiology, where we're looking at things behind the screen. And if you like being able to pick different avenues of how you want to work each day, picking medicine is definitely something to consider.
It's almost like a sampler, like you're trying all these different specialties, rotations in medicine, at blocks at a time.
Number 3, the ability to constantly grow and learn. When it comes to medicine, you're never done learning. You have to continually put in effort, and with that you find yourself growing. You might start out making some simple mistakes that 3 weeks later you would never make again, because you've learned that that's not the way you do things, or this is a better approach to taking care of patients. And it continues well after medical school, definitely throughout residency and deep into attendinghood. And there's still phenomenal physicians that we work with who are, in their 60s and 70s that are still learning and seeing new things, and they're well established in their field. They're experts in their field, and there's still new things to learn.
Mm-hmm. One of the things you'll hear a lot of people say, professors, attendings in medical school, is this is a job where there's lifelong learning. And that is 100% true. we know growth can be very frustrating at times. We've been through it, right? The step exams 1, 2, and 3, the constant exam test taking that there is. And yes, it's really, really hard. But just being able to go in a field where it's just endless knowledge and you're constantly learning. For us, it feels like we're learning like every day. We're learning something new, which is nice. So definitely there's plenty of that in this career.
Another thing that we want to think about when you're talking about picking medicine is the ability to interact with experts, right? Especially when you're in training as a medical student and as a resident, you're going to be dealing with people who really know what they're talking about. And from multidisciplinary rounds to different conferences and lectures that you'll be receiving, you'll be interacting with people who are at the top of their field on a daily basis. And it can be intimidating at times, especially when you're a first-year resident and you're calling the attending who has all this experience and you're telling them about a finding that you think is important. That can be nerve-wracking, but you learn to grow and adapt. And over time, we're seeing this change in the culture of medicine to be one that is, of course, evolving, but hopefully moving towards a position where we value each level of understanding and their input, and so that everyone feels like they have an equal opportunity to make a difference in the patient's care.
And it's not necessarily something that you think of. I know when I was applying, I could care less about I'm going to be talking to some of the best attendings in this specialty. But it's something that we've really appreciated as we're going through residency right now. And just being able to talk to someone in a field who's an expert with this vast fund of knowledge, it's mind-blowing. It's definitely admirable, like the commitment they have to their work. So it's sort of a unique kind of privilege that we have, being able to be in medicine and talk to people who are top of their game in all these different specialties.
Number 5, being an agent of change. This is a huge part. When you're in medicine, what you'll find as you get closer to being an attending is there's so many ways you can impact patients' lives, from all the way at the beginning as a medical student, even as a pre-med, throughout residency, and as an attending. And that's just primarily what you do. But it extends even farther than that. If you want to work in business, in industry, you can impact a lot of different people all at once. And you can do what we're trying to do, which is create a community that's focused on being the next successful group of young physicians and people in medicine that want to do good things for a lot of different people outside of just being in the hospital. You can use all the things that you've learned and all the people that you've interacted with to be an agent for change in a positive direction. And that, to me, is one of the best pieces of what being a physician allows you to do.
And part of this concept of being an agent of change, I think a lot of it is shown in the media, right? TV shows, and your idea of a doctor may come from that, and seeing a doctor save someone's life, that person being a very appreciative, thanking them. That's sort of on the individual level, and certainly there's moments like that in medical school, right? Where you're the one actually telling a patient that they have this disease, cancer, in some situations, and that there's something that we can do to fix it. And that's an incredible experience. Additionally, there's also the impact that you have on the community at a greater, much larger level that I really like about medicine. And we're seeing attendings right now and other physicians basically who are setting guidelines for how to really set the standard of care and best practices for specialty groups, for practices across the country, and certainly taking a role in that. I mean, that the impact there is enormous. So it's not just the individual patient relationships, right? This potentially, you're talking about impacting thousands, hundreds of thousands of people with changes in policy and so on.
And the thing is, what's so amazing about it is you start to see that, a lot of medicine is evidence-based, and you can be part of the evidence that changes why you do something. It's the research that you do, the research that you're a part of, the clinical trials. This is how we shape the future of medicine. And when you're in our position, as physicians, as residents, as medical students, you get to be a part of that. So those are top 5 reasons to choose medicine. We hope you enjoyed it. More to come. If you enjoyed this video, please hit like, comment, subscribe. Please email us for any questions. We appreciate it. Hey everybody, thank you so much for watching that video. If you found it valuable, please like, comment, share, and subscribe.
We're definitely going to closely look at those comments for any feedback. Also, follow us on Twitter, Instagram at Built for Medicine, and feel free to email us at builtformedicine@gmail.com.